Hello and welcome to Oregon Cancer Foundation's Topics in Breast Cancer mini conference. My name is Amy Johnston. I'm the director of the Oregon Cancer Foundation, and it's my pleasure to welcome you here today. Before we get started, I'd like to take this opportunity to thank our sponsors. They are Myriad, Oncotype DX, Caris Life Sciences, Seattle Genetics, and Eisai. Today's conference would not be possible without these sponsors, and we thank them for their support and their belief in our mission and their participation today. As I said, my name is Amy Johnston. I'm the director of the Oregon Cancer Foundation. I'm joined here today by Katie Burke. She is our breast cancer resource coordinator. The two of us are going to be your facilitators for today's session. Before we get started with the session, I do want to familiarize you with the screen here. As an attendee, your microphone and your camera are off, but you can communicate with Katie and myself, as well as the panelists. By raising your hand, we can help you with any technical problems you have. You do have a chat button down at the bottom of your screen, as well as a Q&A button. If you're on a phone or a tablet, those buttons are going to be up at the top right of your screen. The session is scheduled to last for 30 minutes with approximately 15 minutes of question and answer to follow. However, if you have any questions throughout the presentation, feel free to go ahead and click on that Q&A button and type those questions in. We will make sure that we get to those during the dedicated Q&A time. And with no further ado, we're going to go ahead and kick it off.
Well, thank you for joining us again for the Topics in Breast Cancer Conference, October 10th, 2020, here at the Oregon Cancer Foundation. Our first session of the day is Wellness in Your Cancer Journey. We have two fantastic presenters for this session. They are Doctors Winnie Henderson and Christine Kollmorgen. Thank you, doctors, for joining us. Your wellness is their passion. Your quality outcome is their mission. With over 30 years of breast surgical oncological care experience, Dr. Winnie Henderson and Dr. Christine Kollmorgen lead a dedicated team providing the most comprehensive and state-of-the-art innovative approach in treating breast cancer. Thank you, doctors, for joining us this morning. With no further ado, I'm going to kick it over to both of you. Go ahead.
So I need to share my presentation. Let's see here. Just need 2 seconds. Are we able to see this? Is everybody looking at this?
I see Oregon Cancer Foundation screen.
Everything looks good.
All right. I'm Dr. Winnie Henderson, and you already heard the voice of Dr. Christine Kollmorgen. We are introducing this conference today. This is by the Oregon Cancer Foundation. It's our first year. It's very exciting. This is part of a Bras for Cause event, fundraising event. So I just want to remind everyone to go to Vote for the Bras, wonderful bras, and presenter of the event is the Chambers Construction. They're the presenting sponsor. Don't forget about the Girls Night Out events this year. Is going to be virtual. So please sign up for that as well. We are very proud of our red carpet survivors, especially this year, the class of 2020. Out of 10 of these ladies, 7 of them are our patients, Dr. Kollmorgen and my patients, and we are very excited to support these ladies and survivors. Again, the topic in breast cancer is the focus of the mini conference today. Today you're going to have breast surgical oncologist Dr. Kollmorgen and I talk about wellness, as well as nurses, geneticists, physical therapists, plastic surgeons, and medical oncologist, as well as Sherry Crosby, patient of Dr. Kollmorgen, who is a breast cancer survivor, talk to you about her experience. So the day is very full. Hopefully you all will stay throughout this entire talk. So the topic of our talk is seeking wellness during your cancer journey. And the disclosure is that both Dr. Kollmorgen and I are on the board of director for Oregon Cancer Foundation. We are members of the American Society of Breast Surgeons who dedicate to the treatment of breast disease. We also keep on the National Registry approximately 2,500 patients now for the Mastery of Breast Surgery program. We're both certified for oncoplastic surgery by the School of Oncoplastic Surgery, as well as the Hidden Scar program. She and I actually are setting up a new surgical practice that is going to be coming out January 2021, and our center has been certified as a Hidden Scar Center. So that's our disclosure. So after today, this talk, you will be able to discuss non-surgical approaches to promote wellness, as well as ask about the innovative surgical techniques to increase wellness. Just remember that you have a voice and a choice when it comes to your treatment. So be advocating for yourself is really important. We will also give you some resources that is pertinent to your care. Now, Dr. Kollmorgen will talk about this whole list of non-surgical approaches to achieve your wellness. And I will talk about surgical approaches to achieve wellness as well. So hopefully this talk will be enlightening to you and will stimulate some discussion during your discussion with your doctors. Go ahead, Chris, take over.
Well, good morning. Thank you, Winnie, for that great introduction. And thanks all for being here on a Saturday. I know that's a big commitment, but we're hoping that it's worth it for you. You know, what do we even mean by non-surgical approaches to wellness? I think that's a big catchphrase, and hopefully after listening for the next few minutes, you'll understand what we're talking about. You know, Winnie and I remove breast cancer out of people's bodies, but as you all know, anyone in the audience who may be a survivor, the whole breast cancer journey is far more than simply using surgery to remove a lump in your breast or even your entire breast. It involves so many other aspects of your life. In fact, it involves all aspects of your life. So the one thing that most patients encounter right at the very beginning when they hear that diagnosis is, how do I even talk about this with my friends and family? I mean, there's no blueprint for that. Fortunately, we do have some resources for that we share with our patients, and we hope to make these resources readily available. There are two wonderful books about this. One of them actually is written from England, so the language is a little different, but it's a lovely book, and they're just simple little approaches that help you talk to your family or your children in particular about your new diagnosis. On breastcancer.org, which is a website that we use quite frequently as a resource for our patients, there's also a whole section of that, and it's just a place to go, you know, where you can actually learn about such things. The whole concept of prehabitation is actually relatively new. People ask, what is prehabitation? I was just talking about this with my girlfriends. I'm actually in Manzanita right now having a little bit of prehabitation myself with some friends from across the country. And everyone thinks of rehabilitation or rehab, but do you know you actually need to prehab before you're about to run what I call a marathon race? You would never jump into a marathon without ever having done any training. And prehab is really training your body to get ready for the treatment it needs to undergo so that you can then eventually heal and be cured. So we talk to our patients about getting some exercise, simple things like 4 to 8 walks a day, or even 5 to 8 minutes of walking and exercise a day can help prepare your body for what it needs to undergo coming in the months ahead. Vigorous exercise is great if you can do it, but we don't ask you to go start doing P90X if you've not been an exerciser. Obviously, you want to fuel your body with the best nutrition possible, and we're going to really double down at Oregon Surgical Wellness on making sure that every patient who wants to has a treatment plan and a wellness plan prior to embarking on the journey. Stress reduction and smoking cessation, another just key element to helping your body heal quickly and successfully. Anyone in the audience that's undergone surgery or treatment knows, if you've never been there, there's almost no way to describe it. It's a nonverbal experience. I've had myself one simple surgery. In fact, Dr. Henderson was my surgeon, so I knew I was in really good hands. And I knew all the people around me. But even then, laying there on an operating table, looking up at an OR light, not really being in control of my surroundings was very enlightening for me. And there are a number of things that we can do to make that experience more pleasant and to be able to eventually associate that experience with something involved with treating yourself instead of harming yourself. There is a lot of evidence now coming out that actually preoperative therapy such as aromatherapy, hypnosis, stress reduction techniques, and even acupuncture and acupressure can help reduce the stress of all of your treatments. Most people think of acupuncture as something to treat post-operative pain or chronic pain, but actually there's very high value-based evidence that shows that some of these techniques can actually reduce your post-operative responses. Post-operatively, we also talk about cold therapy, massage, guided techniques for reducing stress, the use of muscle relaxants, and then there is a whole program called BRAS, Breast Recovery After Surgery, and we'll go into that in another slide. Chronic pain. Chronic pain really is defined as pain that lasts longer than about 6 weeks. Unfortunately, there are many women who do develop some mild to moderate chronic pain after the surgery. There's collateral damage, so to speak, of surgery and radiation treatments, and there's also collateral damage of the psychosocial aspects of your treatment. There are a number of techniques that can be used, both psychological as well as physical, that can reduce chronic pain. And rather than just suffering with chronic pain, we like to talk about that with our patients. In the immediate follow-up, post-period, we speak about chronic pain and how there are avenues to prevent it and avenues to treat it should you end up having some. Cognitive behavioral therapy around what causes chronic pain, in addition to acupuncture and acupressure, can dramatically reduce and even completely alleviate chronic pain. What about cannabis? Seeing as we're in a state now that is welcoming the use of cannabis both recreationally and medicinally, there really is no hard evidence to support that cannabis helps with the acute pain that may come about after surgery. However, there are evolving evidences that point to cannabis as being a key factor in alleviating or part of the puzzle to alleviate chronic pain. So we embrace that. So what am I actually talking about when we talk about, quote, techniques to reduce stress and post-operative pain? What's the science behind it? Has anyone ever been in the car and you're on your way to work, you might be a little stressed, and you turn the radio on, and suddenly that song that you just love comes on the radio, and you're by yourself and you either sing aloud to yourself about the song or you turn it up and you kind of get this hyped up or warm feeling inside. I'm sure everyone's experienced that. What even is that? What's actually going on physically in your body? That's actually your dopamine serotonin axis kicking in. It produces pleasure in the body. It reduces the sensation to pain. It reduces your sensitization to pain. And you actually might even walk in to work and you're glowing. You have this energy about you and it's contagious. Other people around you actually might feel it too. That's what that is. It's actually a physical thing going on in the neural networks of your brain. So there are things that can be done to trigger that. Something simple as playing a soothing song for 5 minutes before your surgery in your iPad or your headphones can really improve the experience, reduce your stress, and reduce the amount of post-operative dysregulation that you have. Aromatherapy works the same way. I've been anecdotally and hoping to use this more, using literally fresh lavender from my garden. I've brought it into a patient. I put it in a little bag. I ask my patients, of course, if the smell is pleasing to them. And I have them just take a slow, deep breath of that before we go into the operating room. And I've actually seen patients clutching onto that little sachet of smell as they're going off to sleep. It really converts the experience from something invasive and scary to something more soothing, much like if you were going to go into a massage at a spa, and the patient wakes up happier. Acupuncture and acupressure, again, similar. Winnie is using this technique more than I am, but I plan to use it in a routine fashion. And this talks about just a gentle pressure in zone 6 on the wrist can do the same thing. We're talking about that dopamine serotonin axis kicking in and helping to relieve the pain receptors. Early lymphedema education and post-operative massage and compression, obviously key. I don't have a single patient who's not worried about lymphedema post-surgical, especially when we're operating on the lymph nodes. And we have nice techniques to help pre-treat that, as well as treat it post-operatively should it occur. It's a big reassurance to patients to know that there are treatments out there to prevent sort of the scary lymphedema that people look up on the internet and see. And our goal is to prevent that completely, but if it occurs, just certainly treat it. Finally, the BRAS pathway is spelled out here. It's a technique that's promulgated at the ASBRS, preoperative teaching, preoperative medication with Tylenol, intraoperative local anesthetic block, obviously we give during surgery, post-operative Tylenol, a pain diary should the patient need it, careful post-operative follow-up, as well as reducing any side effects, obviously, for that mastectomy with lymph node dissection and or the sentinel lymph node procedure, which Dr. Henderson will talk about later. We want to make sure you know that after your surgery, we're still going to be part of your care. It's not simply have surgery, see us in follow-up, 2 weeks later, and then goodbye. We have a fully embraced follow-up regimen. It's a community standard. We're constantly tweaking it with our other partners at Willamette Valley and our primary care partners. And it's constantly evolving, but we stay up to date on the latest national standards for follow-up. Finally, many patients worry about some of the treatments that they're going to receive in terms of how it makes their whole body feel over the coming months and years. Tamoxifen is one of the therapies that we use in conjunction, obviously, with our partners at Willamette Valley. And many women worry about what that is going to do to their overall sense of well-being. The good news is that many studies are coming out now that show that even if you can't tolerate the full dose of tamoxifen, even just cutting down the dose still gives you a benefit of breast cancer recurrence, but you can also see a reduction in the symptoms, thus making it a more tolerable therapy. And these evaluations are ongoing. So rather than just giving up the therapy because you have side effects that are affecting your lifestyle, we can tailor the therapy to how you're doing so you still receive benefit, but limit and minimize some of those therapies. Similarly, with radiation treatment, some patients with the following profile actually don't even need radiation therapy. So we're staying up to date on what actually is required, tailored to exactly your age and your type of tumor. There is no one size fits all in this situation. This last topic actually is one of my favorites because it involves sex. One of the topics very few people like to talk about. I usually see patients in follow-up 9 months later, and that's really the time to say, how are you doing? Are you getting exercise? Are you sleeping? How's your sex life? Have you had sex since your surgery? Many women don't want to speak about this because obviously going through breast cancer treatment, your hormones have changed, your body image may have changed, your ability to have sex may have changed. And we go through different avenues to make sure that you're using the latest and greatest techniques so that you can enjoy a full and healthy life. A simple thing like a sexual lubricant can completely change your function and feelings in the bedroom, so to speak. Coconut oil happens to be one of my favorite suggestions. It's cheap, it's easy to use, and most patients are really happy to know that there are things that can be done that help improve that aspect of their life. And they're simple things, and just opening the door to talk about it can make all the difference in the world.
So I'm going to briefly go over the surgical approaches to achieve wellness. Oncoplastic breast surgery is actually a very advanced technique of breast surgical oncology, where we are able to combine plastic surgery, surgical oncology, as well as reconstructive surgery. We literally mold the breast tissue together to give patients a nice breast mount. It's truly blending science and art. As you can see, this was pictures of years ago when I get certified, where we actually literally play with clay, so forming art, so to give your surgeons a aesthetic view of the world of the breast. We are certified Center for Hidden Scar breast surgery. With the hidden scar approach, your surgeon will be able to place the incision in a hidden location that's really hard to see, so that the scar is not visible. Now, the end result is that you do not have a visible reminder of your surgery or your experience with cancer in the future after, months and years later. So that's give everyone some happiness and wellness, at least mentally. These are the results of our surgery, and these ladies have different size breasts. And one other thing about these are all consented pictures, and we as breast surgeons often show breast pictures in our conferences and the presentation. And our goal for doing this is to enhance, enrich, and empower you. One of the biggest topic in breast surgical oncology is lymphedema. Lymphedema is a big problem, and lots of women are afraid of that. And as you can see, that there are lymphatics that comes from the arm, from the breast, and everything meets kind of in the armpit. So when you do surgery in patient's armpit, there is a risk of disrupting lymphatic drainage. And this is what we call secondary lymphedema, and it's related to breast cancer treatment. Now, one of the biggest thing that has changed the entire surgical approach since 2010 was a clinical trial that came out with many patients who have undergone axillary dissection, which is removing all of the lymph nodes in the armpit, and sentinel lymph node biopsy, which is a newer technique where it's focusing on just removing a few. In comparison study, even patients with some limited metastatic cancer, meaning cancer in the lymph nodes, have the same survival as those with axillary dissection, but axillary dissection actually cause morbidity such as really bad lymphedema that will affect patients' daily living. So we now have used sentinel lymph nodes biopsy mostly, but in some cases we still do axillary dissection for patients with bulky lymph node. Now, lymphedema, as you can see on the slide here, has different look or different stage. Stage 1 is mild. The stage 2 is something that actually with techniques we can reverse. Stage 3 is a little bit too late. In the figure 2 there, you can see on your left side is the normal lymphatic drainage in the arm, and on the right side is where it is disrupted. So it's definitely seen in our patients at times. With the sentinel lymph node biopsy, the risk of lymphedema is between 2 to 5%. With axillary dissection, the risk is usually about 30 to 50%. That's pretty scary. Another one of the lymphedema that people often not talk about is breast lymphedema. This is truly, it can occur to 50% of women undergoing breast surgery with lymph nodes removal, as well as radiation therapy. This is characterized by diffuse skin edema, swelling, redness, and symptoms of pain, which we encourage a patient to bring this up to attention because there are ways to treat this. So ways. Non-surgical will be early dissection, education, and prevention. And we will also refer patients with this problem to a lymphedema specialist. With those who have axillary dissection, we often will refer them ahead of time before surgery, so they will be able to detect any kind of swelling on their arm and start doing compression therapy and massages. Skincare is a big deal when it comes to lymphedema, exercising, lymphatic drainage. Now, Dr. Kollmorgen and I both practice state-of-the-art techniques, and there's actually a clinical trial that is ongoing right now with Dr. Susan Kleinberg for the axillary reverse lymphatic mapping. What this is that we inject dye into your upper arm, and we actually map out your lymphatics to avoid those lymph nodes or lymphatics that is blue coming from your arm. And in addition, we actually inject a dye, a radioactive dye into your breast. And we wanted to know if there's any crossover and try to avoid destroying or removing lymphatics and lymph nodes that are matters to your arm. And we also tie the lymphatics together to encourage recannulation. Dr. Klingberg, who I have met numerous times in conferences, has a mouse model that actually suggests lymphatics do recannulate, meaning coming together, just like the neurons in people's body. Now, when we recognize that patients have stage 2 lymphedema, we actually encourage them to have a consultation with specialized plastic surgeon who will do lymphatico-venous bypass or lympha procedure or lymph node transfer. These will procedure allow release as a scar of the lymphatics, as well as bypassing to actually get rid of lymphedema. And so having lymphedema is not reversible if it is recognized early. Now, we also pay a lot of attention to dog ears. It's a funny name for extra tissue under the armpit. When women have no reconstruction after mastectomy, they often notice this lump under the armpit where they are not able to wear a bra. It's very uncomfortable when they put their arm down. Dr. Kollmorgen and I both utilize techniques to get rid of these extra lumps under the armpit so that they will have just one surgery instead of needing to have second surgery for dog ears or being referred to other plastic surgeon to deal with this. As you can see, these are our patients. And we both utilize this VY advancement flap technique to get rid of the extra tissue under the arm. This patient is a patient of mine. It's fresh off the press. I just saw her on the 6th, and she's about 3 weeks out, and it looks beautiful. Now, you need to know that you have a voice and a choice, because oftentimes your surgical treatment has an effect when if your provider has bias. So you need to empower yourself with resources that so that you can make the right decision. These are the resources nationally that you can go to, that you can find information. In addition, here's a list. If you go to breastcancersurgery.com, you can get a list of questions to ask your surgeon. And breast360.org is an awesome resources. All of these articles, information are provided by the American Society of Breast Surgeons, and both Dr. Kollmorgen and I have been members for the last 10 to 20 years, and lots of great information, such as the one, self-care and spiritual wellness for cancer patients. So with 1 out of women being affected in their lifetime with breast cancer, you need to know that there are options for your surgery. Hidden scar breast cancer surgery is one of the ones that will empower you to make you feel that you would not have to be reminded of your breast cancer treatment every day of your life. And we encourage you to look into this. You can find surgeons in your area by going to at least 2 sites, Hidden Scar Breast Surgery Program, as well as the American Society of Breast Surgeons. You can find a surgeon and do a member search. Dr. Kollmorgen are both certified again as hidden scar surgeon, and we've been member of the American Society of Breast Surgeons. We're very excited to bring you in January 2021 a very comprehensive surgical wellness center called Oregon Surgical Wellness, and we will be integrating, this is a beautiful slide in the middle where we integrate naturopathic oncology colleagues with care. They will be co-locating with us to treat your problem. And recently there is a targeting cancer series video that you can look up on the internet, and Dr. Michelle Neasley and Dr. Stacy Dunn talks about how they can increase patient safety and reduce your side effects while you're undergoing treatment. And they are 2 naturopaths, naturopathic oncologists with Pacific Integrative Oncology. And thank you for your attention. I hope I didn't go over too much. I guess I'm gonna turn this back to Amy and Katie for question. I'm not technically very good, so I'm gonna let them drive this part.
All right.
Should I stop the share?
Thank you so much, Drs. Henderson and Kollmorgen. That was a fantastic presentation, and you did not go over at all. So great job there. We were a couple minutes late getting started, so but we're doing okay on time. So we do have a few minutes for question and answer, and I know that some of you out there may have questions that you'd like to ask of these amazing ladies. There should be a button at the bottom of your screen that says Q&A. If you have your questions, type those in using that button. If you're on a desktop or laptop computer, if you're on a phone or a tablet, it's going to be in the top right corner. All right, we're going to give you just a minute to type those questions in. Well, Doctors Henderson and Kollmorgen, that was fantastic. And we're really excited about your new surgical wellness practice here in Eugene. I think that's going to be a fantastic addition to our community. And it was really exciting to see your presentation this morning. While we're waiting for those questions to come in, were there any last thoughts that either of you would like to add to the presentation?
I want to add one thought. I just want to thank my partner, Winnie, who did prepare that presentation while she was on call last weekend, and she cranked it out in, I think, about an hour and a half, which speaks to how much passion she has about the subject matter. So I just wanted to give a shout out to her. She did a great job, and we hope to continue to refine the presentation as we move along with this new concept.
Thanks, Chris.
That's fantastic. We did have, well, folks are typing in their questions. We did have a comment as well. This participant says, no question, but I just want to say that your voice, your choice is validating.
That's great.
All right, so we do have a question here. This question is, does your oncologist give the referral for potential lymphatic bypass surgery?
You know, anyone in your team should be able to send a referral. Eugene is a pretty small community, and we work very closely with all of your oncologists, radiation oncologists, your plastic surgeon, your physical therapist. Our communication is almost seamless. You should be able to get a referral. Unfortunately, we do not have anyone for a specialized plastic surgeon who do the fancy lymphatical venous bypass and lymph node transfer. We will have to send you out to Portland, who I actually know a couple of surgeons who will do that, and they will take the referral and take care of you. And over the past, we have done that. And Willamette Valley Cancer Institute's oncologists are very aware of this as well. So whoever recognizes the patient that has grade 2 lymphedema, should be prompted to, to send a referral.
We can help with that too if someone gets stuck.
Yeah, we definitely, one phone call, just give us a call and we'll be more than happy to help you.
Thank you. Thank you for answering that. So we're going to give it just another minute and see if we have any other questions that come in. While we're waiting for any additional questions that come in, I'm wondering if one more time this morning, if you can share good contact information. If individuals have questions after the fact, they can send those through us and we'll forward to you. But if they want to find you online or get in touch, what's the best way for folks to do that?
Currently, we are, as you can understand our transition right now, we are still surgeons with Northwest Surgical Specialists. We will be here until December 31st, 2020. And then January 2nd is potentially our grand opening for Oregon Surgical Wellness. We do have a phone number and fax already set up, which is actually on one of the slides. The phone is functional, and if there is any concern, questions, you're welcome to either contact us at Northwest Surgical right now, or the phone number that is listed on the screen on the computer. And we'll be more than happy to do a second opinion or a referral or whatever you need, because we really, Dr. Kollmorgen and I have been in this community forever. She's been in practice here for over 23 years, and I almost 11 years, and we just love our community and we just wanted to help.
Winnie, we have one more question. How do you find out what options are available for dealing with chronic pain? Or Dr. Kollmorgen, sorry.
Yeah. Go ahead, Chris.
Well, first of all, we need to know about it. And so certainly any one of our patients who've been treated by us, you come in and talk to us about it. Even if you have had surgery 10 years ago and you didn't have the right contact, we're happy to see a breast cancer patient who is suffering from chronic pain, and we can head you in the right direction. Anyone on your team should be able to direct you to that.
Yeah, and a lot of the times the pain is caused by extensive scarring, and there's actually a myocutaneous massage, breaking down the scar tissue that a lot of the pain doctor actually utilize. Anita Backer is one of the colleagues who actually treat pain, chronic pain. We're more than happy to refer to the chronic pain doctors who utilize multiple different techniques. We kind of in the know. So again, we would be happy to help.
So do you recommend, like, if a survivor is dealing with chronic pain, to even mention it to everybody in their team? I mean, it's not a waste of time to get multiple opinions in regards to the art of medicine, and everybody has an approach.
It's not, you know, pain is a funny, interesting thing. If you let your pain go too long, those nerve fibers are overfiring. Sometimes the early intervention to shut it down, even with injections, steroid injections, sometimes we can get control of those pain fibers before it goes out of control. So the sooner the patient tell us that, you know, they have a problem, we will deal with it. You know, immediately after surgery, a lot of times we actually use Lyrica and gabapentin if, say, their pain under in their underarm is really bothering them, just because this is a short-term treatment, but we want to shut those pain fiber down. If you shut it down early, you will not have this overwhelming pain syndrome. So, Chris, you can comment on that.
Do you guys use it preventatively?
No, well, I don't think so, because there's addictive problem, right?
Yeah.
So, go ahead, Chris.
The whole goal of the techniques that we talked about in our talk are directed specifically to prevent chronic pain. The best treatment for chronic pain is to never get it to begin with.
Yeah. And
to approach the problem in a more programmatic way, in a more organized way, and that's our goal. We're hopeful that the incidence of chronic pain after treatment will drop. But should you be unfortunate to develop this, the sooner we know about it, the better. And it really depends on the case-by-case situation, but Dr. Henderson and I can direct you to therapies that are designed to help reduce it. We just need to know about it ahead of time, or know about it as it's in real time.
Exactly. There's one thing that I actually didn't talk about is the scapulothoracic syndrome, which again, Dr. Klingberg was just a wonderful doctor and scientist. There's people actually have pain in their back under the scapular after surgery, which can be treated. It's a bursitis, you know, inflammation of the bursa in the back, which you can actually shut down that pain with injection of steroids.
1 to 2 injections.
Exactly. So, you know, funny, interesting things, just talk to your doctor, talk to your surgeon, and get help, because we can help you. There are so many little things in breast surgical oncology that, you know, patients don't know about, but talk to your doctors, because your doctors are, you know, going to meetings and talking to colleagues, and we're here to help you solve your problem.
Thank you, guys.
Thank you both so much. All right, and with that, we don't have any further questions at this time. As I said, this session is being recorded, so for anyone who's watching it as on record and has questions after the fact, you can send those in to Oregon Cancer Foundation, and we'll be happy to forward them on to these amazing surgeons. And with that, we are going to close this session, and so that we have time to get into our next session. So for those of you who have signed up for an all access pass, we're actually going to close the first session of the day, and we will rejoin you.
There's one more question. Sorry.
Oh, there is one more question. Okay, we can take just 2 or 3 minutes before we need to switch over to the next session. So the question is, what about chest numbness?
You're probably talking about chest numbness after mastectomy. You have to understand, with a mastectomy, we are detaching all of your breast tissue off your skin and your subcutaneous tissue. The innervation of the skin is from below, and some innervation is from above, meaning from the side, the rest of the skin. Some of those innervation on the skin will come back, not all of them. So going in, thinking about mastectomy is the cure-all. The cure-all, it's probably, a little bit of misleading, because yes, you get rid of your breast, and yes, you get rid of your cancer, but there is a lot of side effects. We actually, especially for the prophylactic mastectomy, we actually go with a article. There's the American Society of Breast Surgeons has an article that lists all of the things that you should think about before you commit yourself to prophylactic mastectomy. And we always give that handout to our patient to think about all of those things, because we never know who is going to lose sensation, because a lot of times with a big incision, or that's for simple mastectomy, or a reconstructive surgery where everything underneath is detached. So we don't have the crystal ball to predict who's going to have chest numbness and not. But most people shouldn't have too much chest numbness with a lumpectomy or partial mastectomy. So, Chris, do you have any comments on that?
No, some of it has to do, there's some cognitive behavioral therapy around numbness that can limit or minimize its effects on a patient. We do our very best effort to make sure people know that it's a possibility. Unfortunately, it is falling in one of the categories of collateral damage. So it's a trade. You trade reassurance about breast cancer recurrence for a side effect. I would say overall, though, the number of patients who are deeply affected by chest wall numbness is small, fortunately, but it is an unfortunate side effect.
Thank you guys so much for taking your morning, and I hope you're able to enjoy the rest of your day.
So can I just say hello to Lynn and Charity? Thanks for being here. And Dr. Michelle Neasley and Dr. Dunn are also in the audience. Hello, guys.
Right.
I just figured out how to use this Zoom webinar chat thing.
All right, everyone. We have just a few minutes before we need to start our second session of the day. So for those of you who are joining us for an all-access ticket, or who've signed up for the next session with Rebecca Gores and Joanne Middleton, we will see you over there in just a minute. Thank you again, and have a great Saturday.